Let us learn now when and how to perform adult rescue breathing. Always begin with an ABC check. Following the 911 call, open the person's airway, check to see if the person is breathing, and if they're not breathing, give them 2 slow breaths. Once the 2 breaths go in, now check for signs of blood circulation.
If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over, you are too exhausted to continue, the person begins to breathe or vomit, the person loses signs of circulation, the area becomes dangerous.
Please pause the video and discuss the meaning of respiratory arrest and why we give rescue breathing. Let us now learn when and how to perform adult CPR, also known as cardiopulmonary resuscitation. Did you know when the breathing stops, the brain begins to die in 4 to 6 minutes? The average 911 response time is 9 minutes. Without immediate CPR, the person has little chance of survival.
If the person is not breathing and they have no signs of blood circulating, this means that the heart has stopped pumping blood around the body. So what we need to do is immediately give the person chest compressions to circulate the blood and breaths to oxygenate the blood. When you combine chest compressions and breaths, you're doing CPR and you're helping to keep them alive.
Signs of no blood circulation include unresponsiveness, no breathing, no coughing, no movement, bluish color of the skin, absence of a carotid pulse. If you are unsure whether the person has signs of blood circulation, don't delay care. Just begin CPR.
If the person is not breathing and has no signs of blood circulation, initiate adult CPR for cardiac arrest.
To find the hand position, place the heel of the hand 2 fingers above the bottom of the sternum. Crawl up the ribs, place 2 fingers above the bottom of the sternum, and plant the heel of your hand above the 2 fingers.
An alternative way to landmark or find the hand position when doing CPR is to take the heel of the hand and place it directly in between the chest muscles, also known as the lower half of the sternum.
When giving 15 compressions, keep your arms at a 90-degree angle to the body, keep elbows locked, compress sternum 1.5 to 2 inches. Do 15 compressions in 9 seconds, about 100 compressions per minute. Keep fingers off the chest.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will force the blood out of the heart and circulate it throughout the body. Give 2 slow breaths to oxygenate the blood now. Continue 15 compressions and 2 breaths for 4 cycles. CPR circulates and oxygenates the blood. It helps to keep the brain and vital organs alive. A few things to remember when doing CPR is to keep your arms at a 90-degree angle to the body. Keep your elbows locked. Make sure your arms are straight up and down. When doing compressions, make sure that you are pushing at least 1.5 to 2 inches deep. If you feel the ribs break, keep going. Let's sit back and watch the rest of the 4 cycles. Once you have completed 4 cycles of 15 compressions and 2 breaths, stop CPR and recheck for signs of blood circulation for no more than 10 seconds.
If the person is still not breathing and has no signs of blood circulation, continue adult CPR for cardiac arrest.
Let's take a look at CPR simulated on a real person.
Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of circulation return. The area becomes dangerous. Things to consider.
To rescue or CPR can be done if there is more than one trained person at the scene. Each person on opposite sides of the body will share the responsibility of giving 15 compressions and 2 breaths.
And 1, and 2, and 3, 4, 5, 7, 8, 9, 10, 11, 12.
1, 2, 3, 4.